Thanks to Kay Miller, we have a wonderful speaker this morning, Betti Conder. She's a HICAP Community Outreach Coordinator and Counselor. Betti has extensive experience in liaison working Medicare and insurance. Prior to 13, she served as a state certified volunteer for HICAP. That's pretty cool. For 3 years she volunteered. Her professional career spans more than 30 years of the human resource and insurance fields. It's my pleasure. Please welcome Betti Conder.
Thank you, Chance. I appreciate that. Good morning, everybody, again. It's really wonderful to be here this morning. An inspiration just to hear of all the wonderful services that are being provided to the seniors and the elderly in Sonoma County and other counties, and it's really wonderful to hear. I am from HICAP, and you have some materials on your table, some packets, with some different items that I'm going to go over with you on who we are, what we do, and some other materials on issues that I have heard that are important to your particular group. I'd like to refer you to our brochure, this one here in your packet, the red, white, and blue brochure. This is our HICAP brochure. And we are part of Senior Advocacy Services, which is a private nonprofit corporation whose mission is to provide advocacy services for seniors and others to protect their health, dignity, rights, and quality of life. Senior Advocacy Services provides long-term care ombudsman services, and we also provide HICAP services. HICAP stands for Health Insurance Counseling and Advocacy Program. And what we do at HICAP is basically twofold. We do counseling with individuals who are either Medicare eligible, new to Medicare, have issues regarding what to do if they're new to Medicare, want to find out about claim appeals. We cover actually 6 counties in our HICAP office: Marin, Sonoma, Lake Mendocino, and Napa Solano. So we're out and about in the field quite a bit, especially during open enrollment season, which is October 15th through December 7th. As I mentioned, we do provide counseling services either out in the field at senior centers or in our office in Petaluma. We have phone counselors available 5 days a week from roughly 9 o'clock to 3 o'clock, and people can call our office and do phone counseling if they're not able to get to a site. The second part of our services is what I'm doing here today. We do outreach, we do presentations to any group that wants us to come and do it. Anywhere from a senior living situation where there's maybe 5 or 6 people that are interested in getting information, to groups such as yours where there's many, many people that we would provide presentations to. What we're really trying to focus on now is employer groups. We've kind of gotten a little bit into the employer community. We did a presentation for Exchange Bank last summer for their employees that were approaching retirement age. We were there along with Social Security and other providers of services for folks moving on to the second part of their life, retirement. We also did a presentation for the City of Petaluma employees who are, again, approaching retirement. So if you know of employer groups that have people that are getting to that age, there's 10,000 people a day turning 65, and many of them are still in the workforce. They don't know what to do when they're approaching Medicare age. They don't know whether they need to pick up Medicare. If they're covered under an employer group health plan, they're concerned about what they need to do. So we like to reach out to those people and assist them. Currently, I'm not sure if you're aware, but if people are on Social Security, they are automatically enrolled in Part A and B when they turn 65 if they want it. But those folks who are still working and maybe not on Social Security yet, they are not notified of anything that they need to do with their Medicare, whether they need to pick it up or not. So it can make a big difference in people's lives later on if they're not doing the right thing, depending upon the size of the employer they're working for. So that's pretty much what we do, and I want to encourage all of you. I think it works better rather than waiting to the end of the presentation, because we may get behind, is to ask questions as I go along. If you have anything about our services that you want to ask about, what I look at all of you as our partners. We get many calls from many of you out in the community who are working with clients that don't really know what to tell them about Medicare, about disability, about Social Security, things like that. Please remember us as a resource for you to call and find out answers if you're not sure. We really would like to work with you on that. So the second piece of information I want to go over briefly, I'm not going to go into too much detail, is this green sheet, which is kind of our Bible when we're doing a new to Medicare presentation or a counseling session. And I'll just kind of briefly go over it. There's a lot of information in here. On the 2005-15 Medicare and your options on the first side, we talk about the options with people. Option 1, option 2, option 3, and option 4, depending upon how they want their Medicare to work for them. Option 1 is the original Medicare scenario where you have Medicare in place. As you may or may not know, Medicare is not 100% insurance. Basically, it's at 80% and the patient is paying 20%. Some people want to protect themselves against that financial liability, so they'll purchase a Medicare supplement plan, which picks up what Medicare doesn't. And then finally, Medicare does not cover prescription drugs under original Medicare. So to protect yourself against that expense, people would purchase a Part D plan, as in drug plan. So that's option 1. Option 2 is moving into the Medicare Advantage world. Examples of that, especially here in Sonoma County, is Kaiser. Kaiser's a Medicare Advantage plan. We have several others in Sonoma County. We're actually blessed here in Sonoma County to have several options. Our other counties are not as fortunate. For example, Lake County has nothing. They have no Medicare Advantage plans up there. And many of the other counties have limited access. We have quite a few. An example, again, would be SCAN, Kaiser, I believe United Healthcare here has a Medicare Advantage plan. And I believe there's one more, and I can't recall what it is. It might be Anthem Blue Cross. So those plans, you would go to the providers in that network, be it the Kaiser docs, hospitals, or if, for example, SCAN, which is new to Sonoma County this year, you would go to doctors that are contracted under that plan. And you cannot go outside the network and have the plan pay for it. The option 2 and 3 are some more unusual types of situations. As I mentioned, employee group health plans, if people are still working, retiree plans, COBRA plans, Cal COBRA. And then finally, option 4 programs are the government programs. They all coordinate with Medicare in some manner. Federal Employees Health Benefit, Medi-Cal, which is probably the most commonly known. And there's several others, TRICARE and Veterans. On the back of your sheet is an overview of the Medicare savings programs, which are programs to help low-income folks with some of their costs associated with Medicare. There's several programs on here. Medi-Cal, again, is probably the most widely known one, and those programs are all administered by the county in which the individual is living, is residing. And there's an application process for Medi-Cal and for all the other programs. And we have the income and asset limits in there, you can see in the middle column. So bottom line, their income can't be above what that stated amount is. Unless in some situation with Medi-Cal, you can have what's called a share of cost, which is an upfront dollar amount that you would be required to pay before Medi-Cal kicks in. And that would be something for people that have a little bit higher income than that one that's stated. And then finally, the last one, and I'll go into some more detail about this one, and I'll have a flyer I want to draw your attention to, is called Extra Help. This is a program administered by Social Security, which helps people, again, on low incomes with lower assets, help pay for their prescription drugs. This has a slightly higher income level and a much higher asset level. So people that don't qualify for some of these other programs could very well qualify for the Extra Help program. In your packet, we have a flyer. It kind of has an overview of the extra help. We really encourage people to, if they have clients that are struggling to pay for their prescription costs, their co-pays mainly, if they go into the donut hole where you're having to pay a percentage of your drug costs, this program is extremely helpful to people. So if you can refer them to us, we can enroll them directly by phone on the Extra Help program if they qualify. It's a pretty easy process. Questions about anything? Wow. Yes, back in the back.
Could you just clarify the donut hole?
Sure.
It's such a weird concept.
Repeat the question.
Yeah, she wanted to get some more information on the donut hole under the Part D program. Your Part D plan will pay up to a certain dollar amount, and forgive me, I don't have that dollar amount with me right now, for your costs. It's a calendar year, so that would include the co-payment for the prescription along with the cost of the drug that the plan is paying. So when that amount reaches, I believe it's around $2,800, you fall into the donut hole. And at that point, you go out of a co-payment and you go into a co-insurance. And I think right now it's 65 for generics and 45 for brand names. So people's costs go up substantially at that point because they're going from a set copay to a percentage. And then there's a catastrophic stage where you reach, I think right now it's around $4,500. Again, when those drug costs reach that amount, you go into the catastrophic coverage, and in that situation, your copays drop substantially to a much lower amount for the rest of the calendar year. Does that help you as far as?
Yeah. It's just so odd. But I don't know if that helps.
Just a note about that, as part of the Affordable Care Act, that donut hole is shrinking every year. So I believe by the year 2020, it's going to be dropping to 25% of your branded generics, as opposed to 45 right now and 65. So that will be dropping every year slightly, so that it's going away. Yes.
Along that lines is that if people have a Part D drug program, usually they send out either monthly or quarterly statements that tell you how much you've paid, how much they have paid, what is your total during the year, and at what point you might be able to track getting into the donut hole.
Did everybody hear that comment? She's basically referring to quarterly statements that your Part D plan will send out to you every year. Every quarter. That exactly as she said, it really it depends upon the company, but they have different ways of presenting that information. They'll usually say, you are here, you have so many dollars till you hit the donut hole, and then it's a status of where you are. So it's kind of a good check for people, so they don't hit that hole and all of a sudden go to the pharmacy. We have many calls like that. Oh my gosh, my copays, they've gone up crazy. And usually right after middle of the year, from the end of the year, we start to get those calls. So if people can follow those statements, they don't get that nasty surprise when they go to the pharmacy and find out about that they've hit the donut hole. Yes?
We were talking about scans, I think, and you said you didn't have coverage if you were outside the network. I'm not sure I understand that. Some of these insurance are only good in Sonoma County, some of them only in the North Bay. Am I correct? How does that work?
Yeah, he was asking about SCAN and broadening that into availability of Medicare Advantage plans by county. They do differ by county. So what's in place for this year for Sonoma County, for example, may change in 2016. SCAN currently is in Sonoma County, Marin County, and they are in Napa County as well. They started in Napa and Sonoma this year, Marin last year. So what they'll do, they come into the county and they contract out to providers, whether it's hospitals, laboratories, doctors, and the doctors agree through a negotiation process that they're going to be a SCAN provider. And so you would be required to go to a physician or a hospital or any medical provider who is part of that network.
Is that the same for United Healthcare,
Yes. We currently have no PPOs in Sonoma County. PPOs usually let you move out of the network if you want to with a higher copayment. But all the Medicare Advantage plans in Sonoma County this year are all HMOs. And again, Medicare Advantage plans, what's in place is in place for a year. So what may be this year may not be next year. Just kind of a little bit, sometimes people sign up and they're surprised when things change, but they can even leave a county. We've had that happen many times. Yeah.
So if you're on Medicare and you travel outside of the county and you get sick or you have to end up in a hospital, what happens then?
If you're on Medicare, original Medicare,
Any of them?
okay, if you're traveling, they're handled differently. If you're on original Medicare with a Medicare supplement, which was that first option, you can use that anywhere. Anywhere where the provider accepts Medicare, the doctor. If you go into a Medicare Advantage plan, there is a limitation on what they will treat you for out of the county. Typically, it's emergency care, which is a sudden onset of illness or injury. So if you're, for example, on Kaiser and you're traveling to a state where there's no Kaiser and you're not feeling well and you develop a stomach flu and you want to go to a doctor, that would not be considered an emergency, so Kaiser would not cover that unless it developed into something more severe aside from just a stomach flu. So kind of rule of thumb is for folks who are going on to Medicare, if they're considering traveling, visiting family and friends, traveling quite a bit, it's really best to go onto a Medicare supplement plan, which you can take anywhere you want to.
I turned 65 this year, and Kaiser members, I've been a long-time Kaiser patient. So Kaiser told me they started Senior Zero plan, where you pay zero, but your co-pays go up a little. Because of scan coming in, they needed to compete, but they didn't have the population in Sonoma County, so they partnered with Sacramento Kaiser to increase the population area. I don't know if this helps anybody, but I was pretty excited to find out that Kaiser has a zero plan. But of course now you're saying all these plans are only good for a year unless they don't change next year, then it'll, yeah.
Yeah,
So there's
that's correct. You're absolutely correct. She was talking about Kaiser. Kaiser came out with a zero premium plan this year in Sonoma County, which was new. Nobody had ever seen that happen before. They had two. They had a zero premium and they also had a premium plan. From what I'm hearing from my colleagues, that it's pretty strong that zero premium plan is going to continue next year. That's what the hearsay about it, but I'm sure it's pretty popular, and they've gotten the enrollment on that. And yeah, in exchange for that, you do have a slightly higher copay for your doctor's office visits, but it's a good deal for people. Yes?
I'm just curious about those additional plans, FGKLMN. And can you just address those in a nutshell?
Sure. Yeah, she was talking about on your option 1 with the Medicare supplement plans with the little box at the very bottom of the left-hand side. There's an alphabet soup of plans to choose from. As you can see, there's A, B, C, D, and on. Those relate to the benefit level of the plan. So, for example, some of you who have a Medicare supplement may have a plan F if you want the best coverage. F covers just about everything that Medicare doesn't cover. But again, it's got the highest premium for that plan, so you get the good and the bad with that. If you wanted a lower premium, you could go to a lower benefit level. For example, maybe a C or a D. They probably don't cover, for example, the deductible. They may not cover the hospitalization coinsurance. So they kind of carve out benefits from the plan to either give people an option of getting the best plan for the highest premium, or maybe a little bit lower benefits for a lower premium, but you still got the protection in place against the majority of the extra charges. Yeah.
So if you're 65
you're still working, is there a benefit to enrolling in Medicare sooner rather than later? Because I know, at least for my father, he's accepting Medicare. He's also still paying into it, plus paying the supplemental. So he's actually paying a lot more for his health insurance than he had been before he was 65. So I'm just wondering what
Is he still working?
Yes.
Is it a large employer, 20 employees?
No.
Okay, so yeah, that's kind of really where the road divides with people that are working. If you're working for a large employer, which is defined under Medicare rules as 20 or more employees, that insurance is required to be primary insurance, same as any other employee that's working. So they would be primary, and if the person did choose to pick up Medicare, that would be secondary insurance. If it's a small employee, under 20 employees, completely changes around. Again, it's up to the employer, but most employers in that situation require the employee to pick up Medicare, Part A and B. And then the Medicare plan is primary and the employer plan is secondary. So it kind of switches around.
Okay, so if he's self-employed, then that would fall under the same auspices?
Yes,
Okay.
yeah. And keeping in mind that there is a premium for Part B for most folks, it's $104.90 a year for this year. So they'd have to offset the cost of whether or not they wanted to pick that Part B up.
Okay.
If it's a secondary insurance and pay $104 a month. You are not penalized if you are working and decide to defer your Part B coverage. When your employment situation changes, whether you retire or you leave employment, at that point you have a 8-month window to enroll in Part B without a penalty.
Okay.
So all you need to do is get a letter from your employee. There's actually a form from Medicare that says this person was covered under our plan from this date to that date, and you provide that. Yes, over here.
I'm looking at the asset limits section on the green form. If that's total assets, then none of this applies to a homeowner.
The asset limit does not include the home that you're residing in.
Okay.
It's typically an asset, and again, there's a whole listing of what the assets are counted as. It's a second home, rental property, stocks, bonds, IRAs, 401ks. Basically, anything that can be converted to cash is considered an asset, but the home that you reside in is not an asset.
Thank you.
Did everybody understand the question? She asked about assets.
But where is it on here?
Where is what on?
She pointed to something on this form.
Oh, she's talking about the Medicare savings programs on the back, where it's got the income and asset list, amounts listed. So that's what she's referring to. Yes.
At one time, I don't know if it was Medicare Part B or where it was, that if your income was above a certain amount,
Yes.
you had to pay more for it. Is that still in effect?
Yes, that also was a part of the Affordable Care Act. They put in a means testing for both Part B premiums and your Part D, your prescription premiums. So based upon what your income is, some folks would be paying higher for those premiums. In the back.
So if someone, I've seen your brochures in Helena, where I live, at PPSC especially, someone just calls you for a counseling appointment, and is there a charge for that?
No, thank you for bringing that up. That's a very good point.
Because,
No, all our
It's great to
services
me,
are
but-
free. We are, it's 100%, there's no charges. We don't charge for anything. Counseling, presentations, anything. Our services are free to people that need our services. And we also have counselors available, bilingual counselors, Spanish counselors, that can counsel people and can also come out and do presentations in Spanish as well, if that's something that your client base might need. I'll take another question, then I want to jump on to one other piece, which is kind of important. Yes?
I wanted to go on to this piece of.
Oh, good.
About hospital inpatient.
Okay, good. That's what I wanted to cover next. So I think there were some questions about this. There's a handout here about are you hospital inpatient or outpatient? And this applies to what's called the observation stay for individuals when they are going into a hospital. I'll let you kind of read through this when you have a minute, and I'll go over the chart in the back, which is kind of interesting about situations and what happens. But bottom line, if you are going to the hospital, most of these are from emergency room visits, and you are in the hospital on an observation status, which is not considered an admittance to the hospital. That means that they want to just watch you for a period of time to see if your condition stabilizes or if it gets worse or if it gets better. It's called observation status. And I would equate it to outpatient services in a hospital. So those charges are all covered under your Part B insurance. It's not considered a hospitalization. The kicker on this one is that if you do need to have admittance to a skilled nursing facility as a result of your ER visit, you would not be eligible if you're under observation status because you're not an admitted patient. You have to have a 3-day hospital stay as an admitted patient to be able to go on and have coverage in a skilled nursing facility. So that's where a lot of people are getting a raw deal because they're in the hospital. In many cases, they're in a bed. They might even be in a room, but they're not admitted as a patient. They're just being observed. So if they do go on and want to or need the services of a skilled nursing facility for whatever they're there for, they wouldn't be eligible for the services under Medicare. So let me just quickly go over some situations, scenarios in this chart on page 3 of your handout. So, as I mentioned, you're in the emergency room, in your emergency department, and you're formally admitted to the hospital with a doctor's order. That's the situation. Okay. Outpatient until you're formally admitted as an inpatient based upon your doctor's order. Inpatient following such admission. So in that case, your Part A inpatient hospital would pay for your hospitalization, and Part B would pay for your doctor's services. That's a good one, the way that works out. Okay, let's go to number 2. You visit the ED and are sent to intensive care for close monitoring. Your doctor expects you to be sent home the next morning unless your condition worsens. Your condition resolves and you're sent home the next day. Your treatment is considered an outpatient. Part A would pay nothing because you're not admitted as an inpatient. So Part B would pay for your doctor's services.
If you're in the ICU and Part A isn't covering, do you have to pay the daily rate of an ICU bed?
Yes, in that case you would.
That's thousands of dollars because your supplementary won't cover.
Right.
Wouldn't you be considered an inpatient if you're in the ICU?
Inpatient, they're not there for 3 days. So even if they're in the ICU, they were sent home the next day. So those charges would not be paid under Part A, hospitalization.
Sounds like they're not going to be paid at all.
Yeah, I mean, your doctor's services would be paid for the treatment that you receive from the physician.
But not the.
That's right.
Right.
Wow.
It's got to be 3 days. That's why this is such a big.
There, just kind of an FYI, I'm kind of following this a little bit on the internet, and there has been some suggested legislation to change the 3-day hospitalization stay to a 2-day. I'm not sure how far that's going to go, but there is some attention's being paid to this because it is becoming an issue and has been for a while, actually. Scenario 3, you come to the emergency room with chest pain and the hospital keeps you for 2 nights. 1 night is spent in observation and the doctor writes an order for inpatient admission. Outpatient until you're formally admitted as an inpatient based upon your doctor's order. So the Part A in that would pay for that 1 night for the inpatient, for the 2nd day rather, and then the doctor's services and hospital outpatient lab test would be paid under Part B. You go to a hospital for outpatient surgery, but they keep you overnight for high blood pressure. Your doctor doesn't write an order to admit you as an inpatient. You go home the next day. So you're considered an outpatient. Part A, again, would not pay anything for the overnight stay. And your Part B would pay, again, as above, for your doctor's services, labs, intravenous medicines. All right, the last one, your doctor writes an order for you to be admitted as an inpatient, and the hospital later tells you it's changing your hospital status to outpatient. Your doctor must agree, and the hospital must tell you in writing while you're still a hospital patient before you're discharged that your hospital status changed. So again, you're an outpatient. Part A is not going to pay, and Part B would pay for doctors and hospital outpatient services.
Yeah.
Yes, Jay.
I was wondering, now it says that, for the, essentially Part A will not, if you are an outpatient, it will be nothing. Are there any options under the Medicare options that will pay for the outpatient in these situations?
As far as options, you mean like an appeal process, or?
No, I mean like option 1, 2, 3, 4, is there any?
Oh, no. Yeah, the options apply to help people piece together their Medicare with other things. So the bottom line, Medicare Part A is going to be your hospitalization charge. So if they're not paying, there's really no other option for having them pay anything. There are many hospitals now, there is a discharge planner. So if the person is aware and able to deal with their situation, or if they're with a family member, the family member can intervene on their behalf and connect with the discharge planner and find out exactly what's going on with their status, so they know whether they're under observation or whether they're admitted. Because a lot of times there's so much going on and it happens really quickly. The patient may be just dealing with their own issues and not be able to deal with, what am I, my outpatient? So it's really always good to have an advocate with you in that situation who can kind of take the charge and help out. Yes?
So I heard what you said about Part A and Part B and inpatient care, but what if you go for just a same-day surgery, an outpatient surgery? Is Medicare going to pay for any of that? Okay,
Yeah, same-day surgeries are typically done in an outpatient basis, in their clinic, outpatient clinic, and those are all covered under your Part B, all the services with that. Yes?
Okay, so on the last scenario where your doctor writes an order for you to be admitted as inpatient and then the hospital later changes your status to outpatient, Medicare is not going to pay for anything while you were in the inpatient status?
Well, in that case, I'm reading it where they actually were never admitted as an inpatient. The doctor had written an order for it.
But the hospital never actually went
and did it. They considered them outpatient. So they weren't ever admitted. Even though there were orders, they weren't admitted as an inpatient. The hospital changed the orders.
And so the patient is still going to be liable for the charges, even though the doctor wrote the order.
Well, there really weren't, as far as I'm reading this, there weren't any inpatient charges, because they were never admitted. So the Part B would pick up everything, because there was no room charge, no night charge. They were outpatient.
I have a question.
Sure.
In regards to these scenarios, does it make a difference if you are in option 1 or if you're in option 2? Like if you're a Kaiser patient and they decide that you're not inpatient, would Kaiser would pick it up?
Yes.
Versus?
Yeah, she was asking about Medicare Advantage plans, if they have the same scenario. I can't speak to all the plans, but I do have heard that Kaiser does not have that 3-day requirement if they need to send you on to a skilled nursing facility.
But do they also, excuse me, do they also not ask you to pay for your hospital stay like you would under the traditional?
When you join Kaiser, you assign your Medicare benefits over to them. So Medicare is kind of pushed aside. So your Part A, whatever the charges would be for your hospitalization under Kaiser, would be what you would pay. I think typically Kaiser has a per-day co-payment, so you'd be paying that. I'm getting down to 1 minute, so I'll be around afterward if you have further questions that you'd like to have answered. I'll definitely stick around. And also on your tables, there's some evaluation forms that if you have a moment, you can take a second to fill those out. I appreciate that. Also, my boss has just given me some, thank you, Krista. We also help with appeals. If people have situations of any sort that you want to appeal something, be it with a Kaiser plan or a Medicare Advantage plan or Medicare, we can work with you on helping you with those appeals, helping you write them up. We won't do it for you, but we'll be glad to assist you and sit down with you and try and work the key points of what your situation is and why you think that you can get an appeal on that particular denial of coverage or something that you want to get and you can't get it, either through Kaiser or a Medicare Advantage plan. So that's something we definitely will help people with.